Hello everybody, my name is Dr. Richard A. Schulz from Roseman University College of Dental Medicine. This presentation is titled Before the Needle. What I have done is endeavored to cover the content of the Caries Management School Competency written by CODA. Upon graduation, a dentist must be competent in evidence-based detection, diagnosis, risk assessment, prevention, non-surgical, and surgical management of dental caries, both at the individual and community levels, and be able to reassess the outcomes of interventions over time. In dental practices across the nation today, we may have enough time to tell our patients to brush and floss in response to inquiries relating to what they can do better. Brush and floss twice a day, and we'll see you in 6 months, would be the typical dialogue between a provider and a patient. Dentistry today, particularly non-surgical dentistry, involves a lot more than simply brushing and flossing your teeth 2 times a day. That has been the anecdote that we have subscribed to as a body of practitioners for a long time. Although there are significant exceptions to this rule, a majority of us simply don't have time to apply the principles that the CODA standards are referring to. So instead of this being the end, how sad would it be if that was all we could do as dentists and hygienists and providers of dental care in this nation, was to tell people to brush and floss and we'll see you in 6 months. Of course, this requires a behavioral change, not only individually, but also on a national and international provider level. Professor Pavlov did some studies involving training behavior in a dog. He noticed that if he would ring a bell, the dog would do nothing except for hear the sound of the bell. When he placed a bowl of food near the animal, he observed that it began to salivate. So what he did was condition the dog. He would place a bowl of food on the ground and simultaneously ring a bell and notice the drool coming from the animal. After conditioning this behavior in the animal several times repeated, he then noticed that he did not have to place the bowl of food on the ground anymore. He would simply ring the bell for the dog to drool. We can apply that to ourselves in dentistry as it relates to non-surgical dentistry. We need to move away from simply telling the patients to do what is good for them. We need to use motivational interviewing, active listening, functional analysis, goal setting, and demonstration of appropriate behaviors. It is important for dentists to establish which option works best with each of the employees in their office, and for the dental care team to do the same with each patient in the practice. Health is a state of complete physical, mental, and social well-being, not merely the absence of disease or infirmity. The mission of the CDC is to promote health and Now that we have defined health and disease, we have identified the CODA standard up to which we are held accountable for training competency. Let us define the word prevention as it refers to oral disease. The contemporary definition of prevention is the art and science of managing the risk factors of each individual patient to promote optimum oral health. The Center for Disease Control and Prevention have a long history of monitoring the use of clinical preventive services to provide public health. Increased use of clinical preventive services could improve the health of infants, children, and adolescents to promote healthier lifestyles that will enable them to achieve their full potential. The Affordable Care Act expands insurance coverage, consumer protections, and access to care for the U.S. population, and places a greater emphasis on prevention. So if an increased use of clinical preventive services could improve the health of infants, children, and adolescents, and promote healthy lifestyles that will enable them to achieve their full potential, how can we increase access and awareness to clinical preventive services? And ultimately, who does it affect in the end? The CDC MMWR report of 2014 has a broad scope and is aimed at several targets: breastfeeding counseling, hearing screening and follow-up, developmental screening, lead screening, vision screening, hypertension screening, dental care and dental preventive service, human papillomavirus vaccination, tobacco use screening and cessation assistance, chlamydia screening, reproductive health services. So although we in our field and our profession are focused on the dental care and dental preventive services, let's not put blinders on and lose sight of the overall goal of the CDC and the Affordable Care Act, which were illuminated through this MMWR report in 2014. Notice that the MMWR report of 2014 evaluated the percentage of persons aged less than 21 years who have visited the dentist and the percentage of persons aged less than 21 years who have received dental preventive services, topical fluoride, sealant, or both. Remember, they did not count a prophylaxis as a preventive service due to lack of evidence, and percentage of persons aged 5 to 19 years who have a dental sealant. The MMWR report of 2014 recommends the American Academy of Pediatrics be a stakeholder in these dental care and dental preventive services. The findings in this supplement indicate that millions of infants, children, and adolescents in the United States have not benefited from key clinical preventive services, and that there are large disparities by demographics, geography, and healthcare coverage and access in the use of these services. A key finding in the report was that more than half children and adolescents did not visit the dentist during the preceding year, and 86% of children and adolescents did not receive a dental sealant or topical fluoride application during the preceding year in 2009. More than 2/3 of 5 through 19-year-olds did not have a dental sealant during 2005 through 2010. Looking at this information in 2015 may seem negligible. What we have here in our crop of these young people who did not receive preventive services for 5 years, so we have a generation of infants, children, and adolescents who will be in severe need of surgical services due to the rampant caries that will affect the mouths of this population. And now we see the problem more clearly, that prevention starts before the child is born and continues throughout the child's life into adulthood and beyond. Dental caries is the most common chronic disease of our children and virtually universal among adults. It is both curable and preventable.